This is my friend Danielle, my friend Destiny, my friend Paige, her cousin Danielle, and her roommate Alicia. Hello everyone, my name is Chelsea Wilkinson. Today I'm here to inform and help you gain an understanding of anxiety disorders. I'm going to provide information on the difference between normal anxiety that everyone may experience and anxiety disorders. I am going to do this by giving you information on who is likely to experience anxiety and provide descriptions of treatment, therapies, and how to cope with anxiety. Everyone knows how it feels to be anxious, that nervous feeling you get in your stomach before you have to give a big speech for school, how your stomach turns before an interview for a new job, or how your heart pounds when you feel as if you're completely in danger or harm. It is completely normal to feel for the average person to feel anxious. It is the way that the body copes with these everyday situations. Unfortunately, if you have anxiety disorders, these normal everyday feelings can do the opposite, when this occasional uneasiness feeling may become overwhelming, and an everyday issue, it may become uncomfortable to avoid these feelings. It may cause you to be anxious most of the time without any particular reason. Anxiety disorders are the most common of all mental disorders. There are 5 different types of anxiety disorders according to David G. Myers from his book, Chapter 15, Disorders Psychology, the 6th edition textbook, saying there are generalized anxiety disorders, phobias, post-traumatic stress disorder, obsessive-compulsive disorder known as OCD, and panic disorders. So today I'm going to go into more detail with you about these disorders and how common they are around the United States. Having an anxiety disorder is the most common of all mental health disorders in the United States, and anxiety disorders as a whole cost the United States between $42 to $46 billion a year in direct and indirect healthcare costs. Social phobia is the common anxiety disorders in the United States with about 5.3 million people per year. About 5.2 million people in the United States every day suffer from post-traumatic stress disorders as well. Panic disorders often vary between 3 to 6 million people per year, having twice as many women suffering than as men. While obsessive-compulsive disorders affects 2 to 3 people out of 100, men and women both being affected by this disorder equally. As many of you are probably asking yourselves as well, what are the common signs and symptoms of these anxiety disorders? How do you find out if your loved one may be suffering from one of these health conditions? With every different health condition, there are different signs, symptoms, and risk factors. With anxiety disorder, it is the same way. Each particular anxiety disorder may not affect someone the same way as another. People with generalized anxiety disorders may display excessive anxiety that they will often notice themselves worrying for months and face several anxiety-related symptoms. Persistent worrying or obsessive about small or large concerns. The inability to set aside or let go of a worry they may have, difficulty controlling the worry, difficulty concentrating, and irritability and trouble sleeping. According to MayoClinic.org by the Mayo Clinic staff, there may be times where you still feel anxious even when there's no apparent reason. For example, you may feel an intense worry about your safety or your loved ones. You may have a general sense that something is bad about to happen. These anxiety symptoms may cause the individual to have significant stress in the social, work, and other areas of their life. People with panic disorders, another form of anxiety disorder, can cause the individual to have the recurrent and unexpected panic attacks. These attacks can cause sudden periods of intense fear. This may include pounding heart or accelerated heart rate, which involves sweating, trembling, or shaking with sensations of short of breath, and also smothering and choking. These panic disorder symptoms also, according to Mayo Clinic staff, which includes feeling of being out of control during a panic attack, intense worrying about these next panic attacks that may often occur, fear and avoidance of going out to places where you may also have had these previous panic attacks, and a sudden fear that these attacks may happen again. Social anxiety disorders. People with this disorder, also called social phobia, is the fear of social or performance situations. They feel as if they're being judged, embarrassed, or rejected, and the fear of being offended by others. The Mayo Clinic staff talks about how this disorder may have many occurring symptoms such as feeling very self-conscious in front of other people, afraid of being humiliated, embarrassed, or rejected, worrying about an upcoming event where people may be for weeks and weeks or months in advance, staying away from places where other people, and having a hard time keeping or having friends. I highly recommend if you, a loved one, or anyone that you may know has any of these health conditions or symptoms so that they can be evaluated by a doctor or the local healthcare provider for anxiety disorders. Anxiety disorders often begin with a visit to a primary care provider. There are many physical health conditions such as thyroid problems, low blood sugar, or taking certain medications that often can imitate or worsen anxiety disorders. Thorough mental health evaluation is highly recommended and found to be extremely helpful. Anxiety disorders often coexist with other related conditions such as depression or obsessive-compulsive disorder. With many healthcare issues, including anxiety disorders, there is a broad research base all over the world. They have found numerous treatments, therapies that have been extremely effective. I will now explain these treatments and why it is so important to seek treatment for these disorders. Anxiety disorders can have severe consequences if left untreated. People with anxiety do not always receive the treatment that they need according to Anxiety Disorders, the Role of Psychotherapy and Effective Treatment, written in 2004. Estimates that only the third of the people with anxiety disorders receive proper treatment. Although there are a number of reasons why they do not want to get treatment, the impact of anxiety going untreated can be very dangerous. People who suffer from recurring panic attacks avoid the situation that they fear may trigger an attack. Such behavior may create problems by conflicting with a job requirements, family obligations, or other activities during their everyday life. People who suffer from an untreated anxiety disorder often suffer from psychological disorders as well, such as depression. They may have a greater tendency to abuse alcohol and other drugs. Their relationships with their family members, friends, and co-workers may become strained, and their job performance may decline. Anxiety disorders are generally treated with psychotherapy medication, or both, according to the book, Overcoming Social Anxiety. They also say that they use talk therapy can be very effective. To people affected, psychotherapy may be directed at the person's specific anxieties and to his or her needs. The most common side effect of psychotherapy is temporary discomfort and involves about thinking and confronting feared situations. Cognitive behavior therapy focuses on identifying challenging and then neutralizing unhelpful thoughts underlying anxiety disorders. This therapy focuses on confronting the fears underlying an anxiety disorder in order to help people engage in anxiety disorders that they've been trying to avoid. Medication does not cure anxiety disorders, but often can relieve symptoms. Medication only can be described by a medical doctor. The most common classes of medications can use to combat anxiety disorders are antidepressants, anti-anxiety drugs, and beta blockers. Some medications are effective only if they are taken regularly. Many symptoms may reoccur in the medication if stopped. Today, more is known about the causes and treatment of mental health program. We know that there is a biological and psychological components in anxiety disorders. According to NIMH.nih.gov, the best form of anxiety treatment is the combination of cognitive behavior psychotherapy interventions. In conclusion, there are many factors when dealing with anxiety disorders, finding out where it may have began and finding out correct treatment and therapies to get through it. Whew. I hope that my speech has given you all a good perspective and an overview about how anxiety can be beneficial to the human body, how anxiety disorders, all types, can cause tremendous suffering for millions of people as well each year. We have gone over the various anxiety disorders, the theories behind them, treatments, and we reviewed for each particular disorder. There has been a broad research base all over the world on this particular disorder, finding numerous treatments that have been extremely helpful to so many children, families, and loved ones to be able to restore to their normal function in everyday life. These people are able to enjoy their rewarding life without the constant fear of negative anxiety stopping them. There is still no saying what the future may hold for this disorder, but with all the relieving and constant advancements in the world, it has given people, our loved ones, and the ones that may be suffering so much hope and strength to never give up.